Welcome back to our Medicare Part A training series. This is Part 3, where we focus on one of the most misunderstood areas of Medicare, skilled nursing facility coverage. By the end of this module, you'll understand the gateway requirements for SNF coverage, the financial timeline your clients face, and the critical gaps that create real exposure. We'll be using the latest 2026 cost data from CMS throughout. Let's start with the 3 gateways a patient must pass through to qualify for SNF coverage under Medicare Part A. First, the patient must have a qualifying inpatient hospital stay of at least 3 consecutive days, not counting the discharge date. Second, the care provided at the skilled nursing facility must be skilled care, meaning services like physical therapy, occupational therapy, or skilled nursing services ordered by a physician. And third, even when qualified, the benefit is limited to a maximum of 100 days per benefit period. If any one of these conditions is not met, Medicare pays nothing, and the patient bears the full cost from day one. Now let's walk through the 2026 SNF financial timeline, because this is where the numbers really matter. During days 1 through 20, Medicare covers the full cost. The patient pays zero copay. But starting on day 21, the patient becomes responsible for a daily copay of $209.50 per day in 2026. That means from day 21 through day 100, the patient could owe up to $16,760 out of pocket just in copay. And after day 100, Medicare coverage ends entirely. Every dollar of the daily facility charge falls on the patient or their family. This brings us to one of the most important conversations you'll have with clients: dismantling the long-term care myth. Many clients assume that Medicare will cover an extended nursing home stay. The reality is very different. Medicare Part A only covers skilled nursing care that is medically necessary and follows a qualifying hospital stay. It does not cover custodial care, which is the type of assistance most people need long-term, things like help with bathing, dressing, and eating. When clients say they thought Medicare would take care of it, this is the gap they didn't see coming. Let's put real numbers to this. Consider a client who has a qualifying hospital stay and then enters a skilled nursing facility for 90 days. During the first 20 days, Medicare covers everything. But for days 21 through 90, that's 70 days at $209.50 per day, totaling $14,665 in copay alone. And that doesn't include any costs beyond the SNF benefit period or any non-covered services. If the stay extends past 100 days, the patient is looking at full private pay rates, which nationally average between $250 and $400 or more per day. This is what we call the incomplete shelter. Medicare Part A provides a foundation, but it is not a complete financial shield. After day 20, costs escalate aggressively. After day 100, there is no coverage at all, and qualification gaps, such as not meeting the 3-day hospital stay requirement, can leave clients exposed from the very first day. This is precisely why supplemental coverage, whether through a Medicare supplement plan, a Medicare Advantage plan with SNF benefits, or a standalone long-term care policy, is essential to limiting catastrophic daily expenses. Let's close with 3 key talking points you can use in your client conversations. First, frame Medicare. Part A SNF coverage as a short-term bridge, not a long-term solution. Help clients understand that 100 days is the maximum, and most stays are shorter. Second, use the 2026 numbers to quantify the gap. When you tell a client they could owe over $200 per day starting on day 21, that makes the risk tangible and real. Third, position supplemental coverage as the answer. Whether it's a Medigap plan, a Medicare Advantage plan, or long-term care insurance, your role is to help clients close the gap that Medicare leaves open. That wraps up Part 3 of our Medicare Part A series.